Does your lower back constantly feel tight or achy, especially when standing for long periods? You might be dealing with something called an anterior pelvic tilt, a postural imbalance responsible for low back pain. My name is Faris Solomon. I got my degree in the study of human movement, and I will cover the common causes of that specific type of lower back pain, how to prevent it from reoccurring, and an exercise program to treat it. Let's go. Lower back pain from an anterior pelvic tilt happens when your pelvis tilts too far forward, creating an exaggerated curve in your lower back. This forward tilt pulls the lumbar spine into extension, which can increase stress on the joints, compress spinal structures, and result in muscle imbalances where the hip flexors and low back muscles become tight while the glutes and abdominal muscles become weak and underactive. This imbalance leads to pain, tightness, and poor movement mechanics during exercises or daily activities. The imbalance also creates a posture where the butt sticks out, the abs protrude, and the lower back overarches. As for the most common causes of lower back pain from an anterior pelvic tilt, sedentary lifestyle, like sitting for long hours, especially with certain postures, which can cause the hip flexors to be tight for an extended period of time. And as a result, this adaptive hip flexor shortening can pull the pelvis forward, contributing to an anterior pelvic tilt and chronic lower back tension. Weak core and glutes, because when these muscles are weak or inactive, they fail to counteract the anterior pelvic pull by tight hip flexors and tight low back extensors. This lack of balance tips the pelvis forward and increases the strain on the lumbar spine. Poor posture habits like standing or walking with an exaggerated lumbar arc or flared ribs, which can reinforce the muscle imbalances that cause an anterior pelvic tilt. These postural habits often go unnoticed but can build up over time, leading to chronic lower back pain and stiffness. Now let's go over a 6-move exercise routine designed to restore pelvic alignment, relieve lower back pain, and help fix that muscle imbalance. Let's get started. The first exercise is a hip flexor stretch. Start in a half kneeling position with one knee on the ground and the other foot planted in front. Ensure your hips are square and facing forward. Gently lean forward slowly until you feel a stretch in the front of your hip on the back leg, and while keeping your torso upright to avoid arcing your lower back. Maintain that stretch for 30 seconds and repeat it 3 times. This releases tightness in the hip flexors, reducing the forward pull on the pelvis, which helps offload tension from the lumbar spine and improve hip extension for better posture and movement mechanics. The second exercise is double knee to chest stretch. Lie flat on your back with both knees bent. Bring one knee up, then the other. Wrap your hands around your chins and gently pull both knees toward your chest until you feel a comfortable stretch in your lower back and hips. Keep your head and shoulders relaxed and avoid lifting them off the floor. Control your breathing to avoid holding your breath or rocking side to side. Hold that position for 20 to 30 seconds. That's 1 rep. Go for 3 reps. This encourages a posterior pelvic tilt, stretching out the lumbar extensors and decompressing the spine to promote spinal flexibility and reduce pressure from excessive lumbar curvature. The third exercise is a posterior pelvic tilt. Lie on your back with your knees bent, feet flat, and arms relaxed at your sides. Focus on your pelvis by engaging your abs and flattening your lower back into the floor. Hold this posteriorly tilted position for 3 to 5 seconds, then return back to neutral. Perform the movement slowly and deliberately to build awareness and control. That's 1 rep. Go for 3 sets of 10 reps. This trains pelvic awareness and control, which is essential for correcting an anterior tilt because it builds the neuromuscular foundation needed to maintain a neutral spine during both movement and stillness. The fourth exercise is reverse crunches. Lie on your back with your legs bent at 90 degrees and feet off the ground. Engage your core gently but without holding your breath, and slowly lift your hips off the floor by curling your pelvis towards your chest and not just swinging your legs. Make sure you clear your tailbone as if you're trying to point it up towards the ceiling. Then control the lowering phase as you allow your hips to return to the starting position while not allowing the momentum to take over, as the movement should come from the abs and not the legs. That's 1 rep. Go for 3 sets of 10 reps. This targets the lower abdominals, especially the transverse abdominis and lower rectus abdominis, as these muscles help flatten the pelvis and stabilize the spine, countering the lumbar extension caused by an anterior pelvic tilt. The fifth exercise is glute bridges. Lie on your back with the knees bent, feet hip width apart, and flat on the floor. Press through your heels as you lift your hips, squeezing your glutes, then pause at the top when your knees, hips, and shoulders form a straight line for 1 to 3 seconds without overarching your lower back. Then slowly lower back down with control. Once this version isn't challenging anymore, you can progress to single leg variation by lifting one leg straight and maintaining level hips. That's 1 rep. Go for 3 sets of 10 to 15 reps. This focuses on activating the gluteus maximus, which is a key muscle in stabilizing the pelvis and pulling it into a more neutral position. It also helps unload the lower back by shifting effort to the posterior chain. The sixth exercise is glute lunges. Begin standing tall, then take a step back into a reverse lunge. As you lower, aim to keep your front knee stacked over the ankle and your torso upright. Afterwards, push through the heel of the front leg to return to standing while focusing on glute activation. Keep your core engaged to prevent arcing your back or letting your pelvis tip forward, and repeat on the other side, moving with control throughout. That's 1 rep. Go for 2 sets of 8 to 10 reps. This builds functional glute strength and stability in an upright position because it reinforces proper pelvic alignment during dynamic tasks like walking, climbing stairs, or lifting, improving postural habits over time. Now, to prevent that type of lower back pain from reoccurring, first, break up long periods of sitting because prolonged sitting can tighten the hip flexors and cause weakness in the glutes. You can remind yourself by setting up a timer to stand up, walk around, or do a few bodyweight exercises. Second, balance your exercise routine by including posterior chain exercises like deadlifts and hip thrusts, as well as core stability work to help maintain pelvic alignment and stability. Third, be mindful of your standing posture by avoiding locking your knees or arcing your lower back while lightly activating your glutes and abs to help stack your pelvis over your hips. Developing this awareness can reduce the risk of returning to an anterior pelvic tilt. You don't have to live with lower back pain caused by an anterior pelvic tilt. With consistent training that targets both the tight and weak areas, you can improve posture, reduce lower back pain, and regain strength during daily activities. So as always, stay active and mindful.